education funding and the timing of it, because a lot of local school boards here, they got the money back and then they may have cut teachers, but it's the middle of the school year, and so they're hesitating to rehire those teachers.
Yeah. We didn't oppose the return of the money. We felt that it should have been found from within savings that they could have found within the current budget. I think she initially promised that. It's another broken promise. It turns out that they haven't found any in-year savings. We gave some advice on where they might find it. We said that canceling the carbon capture and storage program, which is $2 billion of wasted taxpayer dollars. We said the $100 million venture capital fund, deferring the $275 million renovation on the federal building for the MLA offices, deferring the $340 million for the Royal Alberta Museum. I mean, as you can see, I've already found well more than $107 million to restore the education cuts, but they're not prepared to make those kinds of decisions. That's what we see with this government, unfortunately, is they don't know how to prioritize between needs and wants. And it's the reason why we are now running record deficits. We have a cash shortfall this year that they'll admit to of $3 billion. We have an additional cash shortfall that is in the form of borrowing for capital spending of an additional $2.8 billion. So we're facing a shortfall this year of $6 billion. And the fact that they're not able to find the money for priority items, like making sure we have teachers in classrooms and education assistants in classrooms, and are rather spending it on the nice-to-haves, not realizing that Albertans expect them to run a balanced budget, I think is fundamentally what's wrong with the government.
The healthcare question.
Yes.
One of the biggest expenses in healthcare is the professional staff wages.
Yes.
And we have a significant supply and demand issue as well.
Right.
We were talking last night at Health Advisory Council meeting about staff being attracted away from this area towards Calgary already, and they expect that to increase. So we've got a situation where we don't really have the option of reducing wages because we're desperate for these people. What do you see as a solution to this?
I think that our frontline workers should be paid well. I think that we want our teachers, our doctors, our nurses to be among the best paid in the country. I don't think that's the place that you want to find efficiencies. Where we're looking at where the money is going is in the layer after layer after layer of middle manager in the administration who aren't doing direct frontline patient care, who are standing in the way, in some cases, of decisions being made locally. That's where I believe that we will get our biggest cost savings, is if we move to having more local decision-making, a return to local decision-making, much like we had 20 years ago, where operational decisions are decided at the local level by local administrators working with their staff so they can determine what kind of services are being provided in the hospital, how they're going to do their recruitment. I think once you've empowered at that level, you won't have any problem attracting health professionals to the communities. In addition to that, we believe that we need to see an activity-based funding model approach, where funding follows the patient to the facility where they receive treatment. So you actually have administrators given an incentive to find efficiencies at the local level. And we need to start graduating more nurses and doctors from our programs. They made a tragic decision 20 years ago to limit the number of nurses and doctors we would be graduating from our programs. Now we're poaching them from wherever we can, from across the province, from around the world. We have to start living up to our end and graduating more nurses and doctors to meet the needs of our local population. And then also keeping them here. Well, it doesn't do us much good if we've graduated highly trained professionals and then we don't offer them full-time work. So we believe that the federal government program, as well of offering loan forgiveness for professionals to locate to rural and remote areas, is the kind of thing we would like to replicate here so that we don't end up losing that talent. Those are just a few things. The other area, of course, is we have to increase the capacity of our acute care hospitals by making sure that we built enough long-term care beds so that long-term care patients are in the appropriate facility and not bed blocking in those acute care beds. Not only would that save money, that's not the principal reason of doing it. The principal reason of doing it is that it's a much more comfortable environment for aging seniors to be living in an environment that's more like an apartment building or an apartment complex than living in an acute care hospital bed. So we think that those are some of the key things we need to do. Have decentralized decision making, funding following the patient, graduating more nurses and doctors and keeping them here, and then building enough long-term care capacity so that we can increase the capacity of our acute care hospitals.
You probably heard that we've been called down here the forgotten corner of Alberta.
First of all, I've been here 5 times. I haven't forgotten you.
First of all, do you agree with it? And if you do agree with it, how are you going to change it if you're elected?
Well, here's the thing I would say is that there are a lot of municipalities who feel forgotten by the provincial government. And it's because they've created a system where so many decisions are made centrally. So many decisions, whether it's, especially for critical infrastructure, for schools, for hospitals, for roads, for interchanges, are made centrally. And when you make those decisions centrally, you have to cross your fingers and hope that your local MLA has pull at the cabinet table to be able to ensure that they can advocate on behalf of your interests. What happens in large municipalities that only have a couple of MLAs, like Medicine Hat, I think Lethbridge finds itself in this position, surely Fort McMurray finds itself in this position, is that the voice of your MLA is drowned out by the fact that there are so many MLAs from so many other places, particularly the large cities. So I think there are many, many municipalities who feel in this situation. The solution is to change the relationship that the province has with the municipalities, to acknowledge that the municipalities are another order of government, and they have their own local autonomy, they have their own areas of jurisdiction, and they need to have their own source revenue to be able to manage their areas of jurisdiction. And that means flowing more provincial dollars through to the municipal level so that local municipal leaders are able to make those decisions on whether it's a school council, whether it's a hospital board, or whether it's a local town or city or MD council. So we are working on a different funding framework where we would actually dedicate a set portion of provincial revenues that would flow through to the municipalities on an annual basis, so that the municipalities knew that when we ended up with a boom, they would benefit from that boom as well, because the revenues would go up. We also want to get back into budget balance so that we can start generating surpluses again, and then share back a portion of surpluses with the municipalities as well, so that they can benefit from the boom as well as from our immense resource wealth also. We think those two programs combined will ensure that each municipality is able to take care of their own needs without having this dysfunctional system where they have to beg to the province for resources. The second thing, though, is we recognize that there is a huge infrastructure backlog in this province. It's really across the country. If I looked at the numbers put forward by the Federation of Canadian Municipalities, they quantified it a couple of years ago at about 120 billion. If Alberta's share is about 10% of that, because we're 10% of the population, we'd face a deficit of about $12 billion. So that's going to require a dedicated amount of provincial spending year after year to be able to clear it. We think that probably the amount that we can afford to spend and should spend on an annual basis is in the order of about $4 billion. We've swung wildly back and forth between overspending and underspending on infrastructure. When we put together our budgets, we think $4 billion is about the right amount. It would allow us to get not only clear the backlog, but then also get ahead of it within 4, 5, 6 years. The way you then prioritize how you clear your backlog becomes important. We want to get the politics out of it. We want to work with the administration to figure out an objective criteria for determining who actually has a greater need for a hospital or a school or a senior center or a highway interchange. And there's ways that you can do that. You can do it based on what is the growing population of kids or the growing population of seniors, or how many accidents were there on that particular road. And once you've developed that objective criteria, publish the list. And then you'll be able to see where your priority is relative to where another community is, and then just start plugging way down that list.